Week, the first positive case of COVID-19 was diagnosed in Alabama. Since then, a lot has changed, especially for those working in healthcare. Nicolette Schleisman spoke with the chief medical officer at USA Health. She's live at University Hospital. Nicolette?
Devin, nearly a year ago, there was a large tent that sat out front here of University Hospital testing anyone who was showing symptoms of coronavirus before they could go inside the hospital. And it's no longer here, painting a picture of just how much has changed in the past year.
There's a lot of challenges, and we have to adapt on a daily and weekly basis to the challenges that are there.
Doctors say we've come a long way in the past year in the coronavirus pandemic.
We had to cut back on elective surgery for a short period of time. We weathered that. We've done all the work with testing, and we've got testing now literally down to a science. We started the vaccine.
At the beginning of the pandemic, getting a test was difficult. You had to meet strict guidelines to even be tested. Now, that's all different.
That science has changed so fast. We're at a point now where we can get a highly reliable test in less than 15 minutes.
Doctors say capacities at the hospitals in our region are now about what they were during September and October of last year.
So some of the pressure is letting off a little bit, but at the same time, we really don't know what's coming. We're I guess you'd call it cautiously optimistic.
Dr. Michael Chang with USA Health warns we're not out of this by any means. We're just in a lull.
One of the crucial factors here is keeping the hospitals at a point capacity-wise where they can care for patients of all kinds, whether it's COVID or heart disease or cancer or anything in between. And this last year has put us beyond that capacity.
And while we've made strides, there's still a lot of uncertainties.
I think this is a journey. We don't know where the end of the journey is. We don't know when the end of the journey will get to us.
And Dr. Chang urges everyone to remain vigilant in wearing your masks and maintaining those social distancing guidelines to help avoid letting those hospitals fill up again. Reporting live at University Hospital, Nicolette Schleisman, WKRG News 5.